Struggling with lateral knee pain? Beating the crap out of your ITB isn't the answer. Let's talk about what's really going on. So here's the thing, the ITB isn't actually a muscle, it's just connective tissue that originates from your TFL and your glute. So foam rolling it, jabbing it with needles, or using a barbell isn't going to actually address the root cause. It might give you temporary pain relief, but it's just going to come right back. Lateral knee pain often stems up the kinetic chain. Here's 3 assessments that I check with all my athletes who come in with this issue. Number 1, we want to assess hip range of motion. First one on the Thomas test, we're going to look at our hip extension. So we want the thigh to be parallel with the floor and then our shin to be parallel with the leg of the bed. Next, we want to have a look at hip internal rotation, and we're looking at the hip's ability to rotate. If it can't do this well, it's going to wind up the ITB. Number 2, we want to look at our lateral hip strength and stability. So as we're going through this motion, we want to see if our pelvis position drops. If it does, it's going to wind up these lateral structures and put pain on the outside of the knee. Number 3, we want to look at foot control. If our arch collapses during dynamic movements or we shift onto the outside of our foot, we're going to be unstable and change how that loads through the knee. As you can see, lateral knee pain isn't just about bashing the ITB, it's about addressing hip range of motion, single leg stability, and foot control.